Good afternoon, everyone. Kevin Henderson, Grayson County Judge Executive. Today's Thursday, April the 9th, 2020. We just wanted to come to you today and give you an update on what's going on here in Grayson County. We've got with us today, we've got Twin Lakes Regional Medical Center and the Grayson County Health Department with some update on some numbers for you. And hospital wants to talk to you about some things that has changed over there and some things that's going on. Before we get started, I'd like for everyone to remember Darren Dennison. He's a friend of mine, a really close family friend, and he has COVID-19, and he's at Bowling Green Hospital now. He's still in ICU, but everyone, please remember him in your thoughts and prayers. We've got some new executive orders from the governor that's come out. I'm just going to highlight them just a little bit. One that was yesterday is any life-sustaining retail business identified in the executive order, which would be a convenience store, Walmart, Dollar General store, anything of that nature. They want one person per family in there, and what that means is if you have to take, and there's some exemptions. If you've got a single parent and you've got your child with you, of course we don't want you to leave them in the car, but if you've got a 17 or 18-year-old teenager with your other children out in the car, you go in by yourself. Don't take a chance on taking your children in and exposing them to anything as well. So one person per household in stores, and I think the reason this came down is for convenience stores. We was having everybody in the vehicle jump out and run into the store, and that's going to eliminate that foot traffic inside that business. So just be, most of this is common sense. Just be aware of your surroundings and use proper hand washing techniques and hand sanitizer if you have it, and that type thing. Non-compliance number, I want to put this out here again. The non-compliance number, COVID-19 hotline is 1-833-597-2337. 833-597-2337. And I'm going to go ahead and give you the health department line. If you got any health questions, I've had some people call me about health questions. I'm not a healthcare provider, and I'm definitely not an expert on healthcare. So I refer all those people to the health department, 270-259-3141. So up first, I'd like to introduce Wayne Merriweather with Twin Lakes Regional Medical Center and let him go over some things that's going on there.
Thank you, Judge, and good afternoon, everyone. I wanted to talk about a few things that have changed at the hospital since I was here last week ago. And if you come to the hospital now, you'll see all of our employees with a mask on like this. And the reason being is that, a mask is not a sure-proof way of keeping you from getting COVID-19, but it will help prevent the spread. So if I'm wearing a mask, it'll help me keep me from giving it to another employee. And if that employee's wearing a mask, it's going to protect us as much as possible. And so why are we doing that? Well, we've got to keep a healthy workforce in order to be able to take care of our community. I hear so many healthcare employees becoming infected, and we want to try to prevent that at Twin Lakes. So when you come up there for testing or to the emergency department, you'll see all of our staff in masks. I would also encourage you to wear a mask when you're out coming to the hospital or elsewhere, and also eye protection. Again, our healthcare folks are so important, and I'm glad they're being recognized now. You've heard that saying, it takes a village. Well, that's no more true than it is in a hospital. It takes all of us working together to take care of our community. And as a result of that, our healthcare heroes are being recognized. And I want to take just a moment today to thank all of our healthcare heroes at Twin Lakes Regional Medical Center. I want to encourage each of you to do the same. Send them a text, give them a call, send them a message on Facebook. Let them know how much you appreciate what they do. They're putting their life on the line every day, no more so than now as we're treating this coronavirus. And it's not just nurses. It's the med techs. It's the lab techs that are going in drawing the blood. It's our environmental services staff that are cleaning the rooms. It's those maintenance guys that are making sure everything works correctly. It's those folks that are working in the physician offices, in administration, in the billing office. Reach out and let them know how much you appreciate them. I know I do. I've realized that for the 40-plus years that I've been in healthcare, and I'm glad they're receiving the recognition they deserve now. And you reach out to them the same, and just thank our healthcare heroes. Another thing that's different is the way we're going to start doing our testing. We've had our drive-through testing up for about a week now. That's going well. We're probably testing 3 to 4 patients a day. And the turnaround time on getting the results is much improved. We utilize a commercial lab called LabCorp, and we're getting a 2-day turnaround. Now, last Friday, we were contacted by the Public Health Commissioner, Dr. Stephen Stack, along with 32 other hospitals around the state. We've been asked to be a regional testing site. Yeah, this is big news. It's going to increase the testing capacity tremendously. The state has contracted with a company, a commercial lab called Gravity Labs in Covington. They're going to be generating 2,000 test kits a day that will be distributed throughout the state. The state's divided up into 10 regions. Be much more opportunity for testing at those sites. Currently, the testing has been concentrated a lot in the Louisville, Lexington, and Northern Kentucky areas. Now these 32 regional sites will be across the state. The state has also worked out a deal with UPS to deliver the kits on a daily basis, as well as pick those up to be delivered to Gravity Labs, and Gravity is going to have a 24-hour turnaround. So a lot more testing will be taking place, and the turnaround will be much better. I want to share with you that just some of the numbers at the hospital. We've done 49 tests. 42 of those have been negative. We've had 2 positives and 5 pending. Now, those numbers will be a little bit different from what's reported at the health department. This is just what we've done at Twin Lakes. The judge reported earlier in the week about the positive patient that we had at the hospital. That patient has been discharged to home. It was a relatively mild case. They're doing well. And currently we don't have any positive patients at the hospital. I want to talk a little bit about what you've heard so much about, flattening the curve. Sam, if you'll put that graph up. And I'm sure all of you have seen this graph. The horizontal line is the capacity of the hospitals in the country, and then that high curve is the peak, and it exceeds the capacity. And that's what we're seeing in New York and Detroit and some of those other places. Now, the reason I wanted to share that is because I've heard some forecasts now, specifically for Kentucky, stating that the peak is going to be around the middle of May, possibly May 16th. And that's a ways out. And when I first heard that, I thought, well, why is that going to be so long? But after giving that some thought and talking to others, well, that's because the measures that the governor has put into place is flattening that curve. And hopefully that will mean that we won't exceed our hospital capacity, and we'll be able to treat these patients, and we won't have as many as we had some of these other states have had. So Kentucky will be one of the last states to see a peak, but that's a positive thing. And that means what all these measures that we're dealing with, that we're doing ourselves, are being effective. Last week I talked about our surge plan in case we have more patients than we can take care of, or if we have those patients that need ventilator care. I shared with you the arrangement that we're working towards with Owensboro Health. We're continuing those conversations. Had another conference call this week, and we'll continue those on a weekly basis. We're also having similar discussions with Hardin Memorial Hospital, and we'll utilize them as a backup as well. I wanted to just mention briefly about the emergency blood drive tomorrow at the Center on Main with the Red Cross. I talked last week about how successful the first one was, and there's an extremely low blood supply. And so we wanted to sponsor another blood drive. And for those of you that would like to donate blood and you haven't called them to make a reservation or an appointment, it would be best to do so. That number is 1-800-RED-CROSS or 1-800-733-2767. And you can call that to schedule an appointment. Then the last thing, I want to recognize some of the donors that we've had since last week. I appreciate everyone that has made donations. And I know I don't have an exclusive list, but just a few that we've had this week. We've had a cash donation by the First Apostolic Church. We appreciate that so much. Walmart has given us snacks and water for our staff, and also ponchos that we can use in an emergency situation. ECTC, Elizabethtown Community and Technical College, we received a shipment today of masks and gowns and gloves. And then yesterday, they sent us some their 3D printed face shields. I don't know if all of you've heard about that, but they put their engineering department to work in their 3D printers to print those shield supports to hold the plastic shield, and we got our first ones from them last week. We appreciate that. Mark Weaver and members of his church have donated masks, and then Tom and Joanne Glasscock have given us some N95 masks, and we're appreciative of all those donations. So that's an update from Twin Lakes. Thank you.
Wayne,
Yes.
question. How does the regional testing site work? Are people from other counties coming in?
No, we'll still test like we have been. We'll still do it through our drive-through testing, but we'll use the kits from Gravity Labs, and the criteria is a little bit different from what the state has required with previous testing. It's loosened up just a little, so most all the testing that we will be able to do, we'll be able to send to Gravity. Now, you'll still need a doctor's order. You need to call your department or your physician and explain your symptoms, and it's similar symptoms as in the past. All right. Any other questions? Oh. Thank you.
Thank you, Wayne. Sam, you got any questions on there? Anything for Wayne? All right, nothing. Matt, you got anything? Nothing? Okay. Next, we've got the Grayson County Health Department with their update as far as the numbers go here in Grayson County with what's been tested, with the people that's been tested here in the county. And like I said, people don't get lost in a lot of these numbers because we've got the hospital is testing folks that don't necessarily live in Grayson County. So some of these numbers that they give might be they might be in compile with these numbers with the health department, but some of them may not be They might be from Hardin County, Hart County, Edmonson County. They could be from anywhere, so the hospital counts those numbers. So don't get too lost into the numbers, but we're being as transparent with you as possible, trying to let you know what's going on here, and we're going to continue to do that until this thing is over. So up next, Grayson County Health Department. This was Rebecca Lee.
Thank you, Judge Henderson. Good afternoon. Testing supplies are becoming more readily available every day. So this is allowing our providers to be able to test people that in the past weeks did not meet criteria for testing. This will most likely mean more positive cases in the short term. The turnaround time for getting test results has decreased in the last week. It was taking anywhere from 6 to 9 days to get those results. And now we are getting results within 24 to 72 hours. So the most up-to-date numbers that we have, 100 Grayson County residents have been tested, 88 have been negative, 9 are still pending, and we have 3 positives. The newest positive is a 20-year-old male and is at home recovering. We have issued isolation and quarantine orders in relation to this case and their close and high-risk contacts. The recommendations are rapidly changing on quarantining contacts, and some health departments are not as stringent with quarantining as we are currently, most likely because they have so many positive cases that it isn't feasible or even possible to do so. We may eventually do the same thing when we have more clusters of cases, but at this point for our community, we will continue to choose the most prudent path and one that is most protective of our citizens. We want to thank all of our community partners. These numbers we give you would not be possible without the efforts of our partners. The collaborative response of Grayson County's community partners has been phenomenal. We want to also thank our citizens for following the guidelines and recommendations and encourage you to keep up the good work because we know it's hard and we know it's a scary time for everyone. If you have questions about COVID-19 or questions about recommendations for self-care or testing, call our hotline number at 270-899-0467 or call our health department directly at 270-259-3141. Anybody have any questions? Thank you.
Thank you, Rebecca. We've got, there's our latest numbers. And like I said, folks, it's, what time is it? 15 after 12. That could change at 3 o'clock. So if something comes up, we will definitely notify you that it has changed. So it's continually running just like a clock. So I mean, we'll let you know as soon as we know. So one thing that I wanted to talk about is churches. There's sort of been a hot topic, and church services. We want to follow the governor's orders, and but he sort of left it up to the local leaders on what they wanted to do, and as far as like drive up services. And I've had some churches reach out to me and ask me. And quite honestly, I mean, that would be great, especially it being Easter weekend if you want to do a drive-up service. But just be aware, folks, do it smart, and keep 6 foot away from each other, as far inside the vehicles. They recommend that no one exit the vehicle. Everyone stay inside the vehicle. I've talked to a lot of pastors about this, and some of them's wanting to do something for Easter weekend, which I think is great, because quite honestly, I think we need the Lord now more than we ever have, and that would be great, because I miss my church, and I'd like to see my church family again. But if everyone would like to participate and do that, feel more than free to do the drive-up services. We just ask that you follow the guidelines and don't be meeting in the sanctuaries or inside the churches with the congregation. Just stay outside in your vehicles, and just don't get out of your vehicles. And hopefully we'll get back to normal here shortly. out-of-state folks moving in or coming into the state and even into Grayson County. We've got a lot of people that come here and fish and hunt and do various activities outside. We need to remember that there's an executive order out, and it's 2020-266, that if anyone travels from outside the state into the state of Kentucky, regardless of what county that you're going to, that you need to quarantine for 14 days. So if you're going to come here and turkey hunt or you're going to come here and fish, you need to be aware that the executive order is you need to quarantine for 14 days. Now, we've got a lot of folks from that live in Kentucky that's got lake property here in Grayson County, and quite honestly, I mean, we've had a lot of complaints, and we've answered a lot of complaints about those, but we've seen everybody they're pretty well in compliance. Just worry about what you're doing, folks. And if you see a lot of people out driving around and this and that, we've encouraged that. We've told people to get out and drive around. They're staying in their vehicles. If the family members decide to get out and drive through the park or drive wherever they're going to go, and we encourage people to do that because, quite honestly, we need to get out of the house a little bit. This has been going on for quite some time, and mental health is very important right now because it will affect you, and you need to get out and spend time with your family, but use the good social distancing techniques. Everybody do exactly what they're recommending, and we will be fine. I would also like to thank the healthcare workers, the EMS, the first responders, the Grayson Manor, Springview, Beehive, the assisted living, all these folks that, we got a lot of elderly folks, and they're all family here. So remember those folks, and I just want to say a big thank you to those folks. Our retail workers, all of our essential workers that are continuing to have to be out in this and work, and everybody's starting to abide by the rules a little bit better. The hoarding has stopped, and which that's a good thing. And I just want to let everyone know to hopefully we don't have to come to you tomorrow with any bad news, and hopefully we don't have to come to you this afternoon with any more bad news, that we have any more positives here. I just want to encourage everyone to be safe and be smart, and you want to be driven by caution with this, and be sure and be cautious, but do not be driven by fear. Don't let it scare you to the fact that you're afraid to do anything. So just everyone be cautious and be safe, and just remember that we will get through this together, and we are Grayson County strong. So if anyone has any questions for me, you can feel free to call me at my office, 270-259-5000. Any healthcare related questions, please contact the health department on their hotline. And everyone be safe, and God bless.